Welcome to In Alignment, Life, Leadership, and Dentistry. I'm Dr. Sara Mahmood, dentist, aligner educator, speaker, and mom of three, navigating the wild ride of clinical practice and family life. This podcast is your go-to space for all things clear aligners with real talk on dentistry, leadership, and the juggling act we call life. Whether you're looking to level up your aligner skills, build more confidence in your workflow, or just feel a little more seen in this season, you're in the right place. Let's get in alignment and grow together. If there's one thing I've learned about refinements, it's this. They're usually not a planning problem. They're an expectation problem. And here's what I mean by that. When we don't set clear expectations up front, patients assume their teeth will be perfect, not just better, not improved, but flawless. That's just not reality. The way I explain it to my patients is simple. We're moving the furniture around. We're not buying new furniture. Same teeth, better layout. That's what aligners do. So in this episode, let's talk about how to set clear, realistic expectations with patients, how to reinforce compliance, how to handle revisions and refinement fees without guilt, and how to protect your practice with the right documentation. Let's start with the real reason we get stuck in the endless refinement loop. It's not biology, it's not SureSmile, it's us. We don't define success clearly. Patients think treatment ends when their teeth are perfect. We need to shift that narrative early. Success equals meaningful improvement, not perfection. We don't enforce compliance. We say 22 hours a day, but do we actually hold them accountable when they don't wear them? Are you documenting their self-reported wear time? We don't talk about biological limitations. Not every tooth moves the way we want it to. Bone, age, periodontal health, it all plays a role. And we don't draw a line in the sand. When patients think that they can keep asking for just one more refinement, they will. So let me give you a sample script we can use at every first consultation. Susie, aligners gently move your teeth into a healthier, more functional position. But let's be clear, we're improving your smile, not rebuilding it. Your teeth will still be your teeth. We're just rearranging them in a better layout. Think of it as moving furniture around in a room. Also, how well you wear your aligners directly affects your results. 22 hours a day is an absolute must. In our office, we include one complimentary revision for express cases and unlimited for comprehensive plans within 2 years. After that, there is a fee. That's why staying on track is so important. Now, let's talk about compliance. It's everything. Even the most perfectly staged case will fail if its trays aren't worn. So here's what we do to reinforce it. We have patients sign a compliance agreement. We use the SureSmile portal for visual tracking. We take pictures at every single check-in and we upload them to make sure that we are documenting their tracking. We repeat the same message at every check-in. Susie, your trays only work if you wear them. They're not worn properly. Treatment takes longer and additional trays may require an added fee. Now, even with perfect compliance, some things just don't move as planned, and that's biology. Short teeth, clenching habits, tongue posture, bone density, all of it matters. And when you run into these issues, be honest with your patient. Every mouth is different. Even with perfect aligner wear, sometimes teeth don't move exactly as we predict, and that's okay. We'll talk about next steps if we need to make adjustments. Now, let's talk about money. Refinements are where many practices lose profitability and time. I'm a big believer in charging for revisions after a certain point, and here's why. It defines a clear endpoint. It reinforces patient compliance. It values your time, your team, and your chair space. In my practice, all our cases are submitted as SureSmile complete, but we categorize them internally as express or comprehensive and align our refinement policy accordingly. For example, one complimentary revision for express cases, unlimited revisions for comprehensive, but it has to be within the 2 years. Beyond that, there's a fee. It's written in the contract and the patient knows from day one. Now let's address a fear I hear often. What if my patient complains to the state board? What if I didn't finish their case? Here's the truth, and I say this as someone who practices in Texas. Boards don't require perfection. They require progress and ethical treatment. As long as you show improvement in alignment and function, follow safe clinical practices, document your conversations, consent, and case photos, you're doing your job. What isn't required is perfect teeth, unlimited refinements, keeping cases open forever. So protect yourself with strong documentation, and that starts with every visit. At my practice, we take progress photos at every check-in, as I mentioned. We document compliance. We have signed agreements that explain the treatment plan, the fee structure, and what happens if we need to revise. That's not just best practice, that's peace of mind. So if you're stuck in a refinement burnout, here's your action list. Create a clear patient expectation script and use plain language. Reinforce compliance at every visit. Don't assume they remember. Implement a refinement fee structure that reflects your boundaries and your value. Train your team to speak the same language when setting expectations. Document everything, photos, notes, signed agreements, all of it. Because the bottom line is that your job isn't to deliver perfection, it's to deliver improvement ethically, safely, and clearly. And when expectations are managed well, patients are happier, your team is less stressed, and your SureSmile program thrives.